Good afternoon. I'm Steve Rehorst with the Watertown Police Department. I'm the Public Information Officer with the Police Department. I'd like to welcome everyone for coming today and attending the online meeting here. First, I'd like to welcome up Mayor Sarah Karen.
Good afternoon. It's April 1, 2020. Our COVID numbers in Cottington County remain the same again today, 5 cases here. The state went up to 129 cases, and now we have had a second death. We do expect this number to rise and hope people remain calm as it does. Know that it is expected. People who have had a pending test should be strictly quarantined as though they're contagious until they get a negative result. I have a few more actions to report. The park board met last night and made some changes. The park facilities, which attract groups sharing items that numerous people will touch, are being closed to limit the spread of the virus. The dog park will close because people have to touch the same door latch or gate. Frisbee golf will be closed because people need to touch the goal baskets. Playgrounds will close because children need to grab onto the bars and handholds. People should not share a basketball, so no basketball games. Everyone should avoid activities which involve close proximity or sharing of objects like balls or bats. This means no football, baseball, soccer games. So far, people are changing their ways to reduce the spread of the virus, and it is helping. So let's keep it up. Unfortunately, this is not a sprint, it's more like a marathon. We're seeing creative socializing at an appropriate social distance. It is possible, and we can laugh at ourselves too. We're fumbling with the new technology, watching each other on computer screens, doing what we didn't even know we could do. We are seeing change. Not just that people are washing their hands over and over and maintaining social distance like never before. We're also seeing more generosity. The gifts we are receiving are amazing and they will change lives. We're seeing more creativity. How can we help? We're seeing more volunteering and more appreciation for the small things in life. So don't be afraid. Be considerate. Be thoughtful. And be kind. And soon this will all be a memory. One last thing. Right now, the census is going on, and this is very important that every single person be counted in the census. And it's easy to get lost in all the COVID activities that we're hearing about. So far, our county has a 47.3% response, which is really good. Our state average is 37.5%. So you can do the census online at census.gov, or you can wait and something will come in the mail for you. They aren't at this time doing any door knocking, so that will be on hold for a while. Census.gov is where you sign up to do the census, and it's very easy. I've done it already. It only takes a couple minutes. That's all I have, so I will now introduce the CEO of Prairie Lakes Healthcare System, Casey DeBoer.
Thank you, Mayor. Good afternoon, everybody. Here on behalf of Prairie Lakes Healthcare System, Casey DeBoer, President and CEO. We're announcing today a change in our visitor policy, a further change in our visitor policy to a no visitor policy. For the safety of our patients and staff, we are implementing a no visitor policy for patients receiving care at all of our facilities. This policy replaces the restricted visitation policy we put into place on March 14th and will help further protect our staff and our patients. There are a few exceptions, including patients receiving end-of-life care, births, and cases involving minors. Similar policies have been enacted such as this across the state and the nation, and we are being proactive and responsible and ask for the cooperation and understanding from the community as we make these changes. This will take effect Thursday morning, first thing. The no visitor policy exception, so everybody understands what's happening, is that for Mothers receiving care in OB, they will be allowed one care partner, like a spouse. For minors, they're allowed one parent or guardian to be present. And then for patients with altered mental states or developmental delays, confusion, one care partner for those patients. At the Cancer Center, we're allowing one support person to be with those patients. And then in situations where there's near end-of-life situations, 2 family members and appropriate clergy will be allowed. We appreciate the community's support of these changes. They are for everybody's benefit. I guess our message to the community is to stay home, wash your hands, and be well. Thank you.
Good afternoon. I'm Mike Carney, President of Lake Area Technical Institute. For us, this is only day 13, work day 13, since the governor's guidance to close the buildings to the public at Lake Area Tech. But the Lake Area Tech staff and students have done a phenomenal job in responding to the situation. Things are changing at an unprecedented rate. And this would be our second week back from spring break. We find ourselves in only our 3rd day in this new virtual environment. We use that extra week for our staff and faculty to move over 30 programs to an online environment and prepare to work from home. All the public events have been canceled at Lake Area Tech through the month of April. But with safety as a primary priority for Lake Area Tech, we fully support the governor's guidance and will continue in the virtual environment through the end of this semester. We have a little over 5 weeks left in the semester. So for most of our students that are they've completed over 80% of their hands-on work that they need to do to earn that diploma. If they're seeking a 2-year degree, they've completed over 90% of their hands-on work. So we believe we can finish the rest of this work building on that extensive foundation that they have in the online environment. Through the use of video demonstrations, we'll use simulation software. We've bolstered our offerings with video conferencing and other virtual tools. Although we use the term online education, for some of our staff and students, it's really going to be the same program, your same class. It's just that your instructor is going to be coming to you over virtual conferencing, and you're going to be provided your materials via the internet. So we hope that through the use of this technology and the clinical internships and work-based experiences that are continuing for our students wherever industry can support them, that we are still targeting to graduate this class on May 8th. Besides academics, there are numerous items that we have done that we got to take care of for our faculty and staff, both inside and outside the classroom. We're launching a food service app that will allow our students to order and pay for food online and then come by and pick it up outside the doors. We're working out the exact details of that, but that will come online shortly. We've loaned laptops and equipment to both our staff and students to support access to the online environment to make sure everybody can get on. We're rapidly bolstering our technology tools, including adding software to virtually build electronic components and program precision machining equipment from a distance. We have boosted the power on our Wi-Fi so that anybody can come into our parking lots now and get on the internet. And we're doing that as a public service. We are moving forward with the admissions process for our fall 2020 students. We're doing so in an environment where we can no longer visit schools, talk to seniors and so forth. So to do that, we're figuring out ways to virtually connect with students. We have, to support that though, to make the process easier for next year's students, we've waived the $25 application fee, we've deferred the $150 acceptance fee, and we've temporarily waived all testing requirements. So to get into next year's class, you don't have to come on campus and test. We will work out those details at a later date. But we do want you to feel free to apply. We want to be able to keep things moving. We want to keep things like the Build Dakota process going forward and lining up our students with those business partners for next year. All of this will move forward as we work through the scholarship process and your financial aid processes. All of those are now going to be done in an online environment. Lake Area Tech is also supporting our community in a variety of ways. We've been integrated into the city's emergency response. Many of our staff members have specialized skills such as healthcare or law enforcement, and they're ready and integrated into the community surge response. we are working to ensure many students will get the work-based credits as they go through these efforts, as well as offering and making available our equipment and different facilities should they be needed to support the city or the county's response. Our robotics program has stepped forward and is 3D printing facial shields and face masks. Let me just show you an example. So we've used our 3D printers to produce the facial shields and also masks that are both personal protective gear or equipment that's needed by both our healthcare providers and our law enforcement folks. So we've started off that we were doing this just by ourselves, but we've had an amazing response from the community, and a number of people are helping us by either providing it, letting us use their equipment, or by printing some of these items at home and bringing them in. So we're building on a grant that we got from the Watertown Community Foundation, but also in concert with Prairie Lakes to make sure that what we're providing is useful, meets their needs of both the first responders and our healthcare providers. So we're looking forward to continuing that support and any way that our instructors can innovate for both providing not only great support for our students, but also for the community. I could not be prouder of the staff and students of Lake Area Tech for the manner in which they've responded to this challenge. But I also feel extremely proud and blessed to be part of this community and this state at this time. Growing up here in Watertown is where I learned the core values that Lake Area Tech is now using. Our mantra of no one goes without in this family, or that no one goes this alone, are things that we hark back to and are sticking to as we go through this process. For our healthcare providers and first responders, our elected officials, those people who are on the front line of this pandemic, Lake Area Tech ends every daily update with a moment of thought and appreciation for all your efforts, and we pray for your continued strength and well-being. Thank you, and at this time, the Mayor, Casey, and I will stand by for questions. Thank you.
Thank you, Mayor Karen, President DeBoer, and President Cartney for coming and speaking with us here today. As President Cartney said, at this time, if there are any questions from the media, we'll be taking those now.
Hi, a question for Mr. Cartney, if he's available.
Yes.
Mike, this is Mike Tanner at KWAT. I know LATI prides itself in your graduation rates, your job placement rate. I'm just wondering if you've had a chance to talk individually with any soon-to-be graduating seniors who are maybe feeling pretty good just a few months ago about landing a job and starting to pay off student debt, and now they're facing a totally different world out there. What's the mood among your soon-to-be graduates as they enter a really uncertain workforce environment?
Appreciate the question, Mike. We really haven't had time to engage our students on that particular topic. As I mentioned, this is only the third day that they've been back and in this online environment. So we are first and foremost getting them acclimated. But, as we look forward, we're still pushing forward for a May 8th graduation. What exactly that ceremony will look like may look a little bit different. But you're right, there's a bit of uncertainty. But at some point, the first things you'll see come back are those critical jobs that our students are preparing for. So, we know that if they aren't immediately used, that they will be called upon in short order. In fact, a lot of our grads right now are not even graduates yet. A lot of our students have the skills that they're going to be helping out as Watertown deals with this pandemic. Thank you.
Mike, this is Troy from KXLG Radio. A call went out a few days ago from your robotics instructing staff that they were looking for people that had 3D printers to assist with that project. Mike, do you know, are they still in search of those people?
I know that we've had quite a response, and in fact, I believe even a couple of the local manufacturers have offered up their 3D printers. So right now, I believe they still do. People can still send an email to Brooks Jacobson. His contact information is on Facebook, as well as if you call Lake Erie Tech, we can get you in touch with him. But I believe they still are, although we've had a pretty overwhelming response. But this is one of those things where, you know, the more you can produce, the better you are. We've had not only significant number of requests just locally, but we've even had requests from North Carolina and California. So.
And a follow-up question for you, Mike. Your building project, the nursing, the Prairie Lakes partnership that you have with the building project that is taking place on 11th Street up there, is this going to slow that down at all for you?
That work continues. What we've done is we've basically turned that area over to the contractor, and we've kind of said, you worry about the sanitation and your employees in that area, and then we'll keep our employees in on the other side. So that work continues. We believe it's continuing on time. We'll know that for sure on Friday, but I think they're doing quite well with bringing that project hopefully to closure in the 1 May timeframe.
Great, thank you.
Thank you.
A question for Mr. DeBoer, if he's available.
Yes.
Thank you, Casey, for being with us today. I'm just curious. We had the doctor in Watertown who self-identified a couple of days ago with the news that he had the virus. Kind of a two-part question here. What changes inside the hospital if a positive coronavirus patient is admitted there? And do you have the capability of treating that patient for an extended period of time, or would they likely need to be transferred out to a different facility?
I'll answer that first. Dr. Devine sounds like he's doing pretty well. As it relates to our preparation for caring for COVID patients, we have not had any COVID positive patients who have been or are inpatients in the hospital as of yet. But all of this preparation we've been doing and that you've been hearing about is geared towards that moment, because we know that moment will come. And our staff is very well prepared. They have the personal protective equipment they need. They have the training they need on how we handle this patient from the time they present at our door until we discharge them down the road.
Thank you. Mm-hmm. And if I could ask one quick follow-up question of the mayor, if she's available, please.
Sure.
Sarah, thank you. I know you touched on your comments today about the changes that have been made within the Park and Rec programs. Can you just retouch on those quickly for me? What people are still able to do in the park system and what's off limits now? Because, you know, a lot of people assume if I go to a park, I'm outside, I'm not close to other people, I should be okay. But you're saying today that there are some things that people can't or should not do in the city's parks.
Right. Thank you for giving me the opportunity to reiterate that. Basically, it's the things that require touching that we've shut down. So gates that you have to open will be locked. Any facility that requires grabbing on and touching, like swings, bars, playground equipment, that's off limits now. And we don't want to see people doing group sports where they've got a basketball game going. I know in Sioux Falls they're taking the rims off their basketball courts so that people won't have a hoop to go through. And the park board talked about doing that. I'm not sure if they will. If you play Frisbee golf, there's a basket there that you have to touch to get your Frisbee out of. So that's closed off. So that there isn't an opportunity for people to be touching things. But people can still come and enjoy all of the parks and just by themselves or in their immediate family unit of people that live together. And you just got to maintain social distance from others. People will go around you. You can use a bike trail, for instance, and I've used that, and it's no problem at all. The trails are 10 feet wide, and so you can easily go on either edge of it and pass each other and not have a problem. So the park grounds themselves are open and individuals can use them. The golf course will remain open at this time, and we don't want people touching things. So don't touch the flag. There'll be foam in the cups so that the ball doesn't go in so deep that you need to pull it out with the flag. We don't want you touching that. And we'll have one person to a cart so that we aren't having people close together on carts and mostly people walking. That'll be just fine. And we'll continue to operate that way as long as we can. And if we see a problem developing, then we will change. And we were seeing groups of kids playing touch football or basketball, and we don't want to do that. The virus spreads by people touching their face after they've touched a surface that has COVID on it. So because people sometimes can't tell that they have COVID and are contagious, that's what happens is that the day of a person coming down with a fever, they feel fine for a while and they might be outside enjoying a game of basketball with their friends, and the ball's bouncing back and forth, everybody's touching it, and then people get sick. So that's what we're trying to head off. You can still enjoy the parks by yourself and just with a social distance.
One quick follow-up too, Mayor. As long as I have you at the podium there, we were emailed a news release this afternoon from the development company talking about a zero-interest loan program, a loan fund. The city of Watertown has donated to that fund along with the development company, a couple of banks, municipal utilities, and a sizable donation from T. Denny Sanford. Can you talk about a little bit about that news of this zero-interest loan program and how important that will be for businesses who are trying to stay afloat during these tough times?
Yes, I can talk about that just a little bit. Chris Shilkin from the Watertown Development Company will be here tomorrow to talk more about it. But basically, immediately when we started to understand that there would be impact to the businesses, the community members started reaching out, and the idea of creating this this fund came together. The city's contributing toward it, municipal utilities is contributing toward it. This morning, I got a call from Dana Dykehouse telling me that Denny Sanford himself is writing a personal check, and it's really wonderful. So Chris Shilkin will talk about the details tomorrow, and I'm not sure exactly. I don't want to get it wrong, but it's a wonderful thing for our community to have this. And we also have another fund with the Watertown Community Foundation is providing a fund for nonprofits so that they can continue to do the work that they're doing during this time. So we've seen a tremendous outpouring of gifts and donations and help. So it's really wonderful. It's just great to be part of this town.
Thank you, Mayor.
You're welcome.
Mike Tanner.
All right, if there's no more questions from the media at this time, we'll end the briefing. I want to thank everyone for coming today. Mayor Karen, President DeBoer, and President Cartney. Appreciate your time coming in today, and we'll see everyone again tomorrow at 3 p.m.